Question 1. A patient on high-dose anticoagulant therapy reports sudden severe back pain and hematuria. What should the nurse do first? A. Discontinue the anticoagulant therapy. B. Assess the patient's vital signs and notify the physician immediately. C. Administer a dose of vitamin K. D. Place the patient in a supine position and observe. Answer. B. Assess the patient's vital signs and notify the physician immediately. Rationale. Sudden severe back pain and hematuria could indicate internal bleeding. Assessing vital signs and notifying the physician immediately are critical to manage potential complications. Discontinuing the anticoagulant without physician approval could worsen the situation. Question 2. A nurse is administering chemotherapy to a patient. Which action is most critical to ensure patient safety during administration? A. Administer the chemotherapy drug slowly over the prescribed time. B. Verify the chemotherapy regimen with a pharmacist and another nurse. C. Prepare the drug in a well-ventilated room. D. Monitor the patient for allergic reactions only after administration. Answer. B. Verify the chemotherapy regimen with the pharmacist and another nurse. Rationale. Verifying the chemotherapy regimen before administration is essential to prevent errors in the drug type, dosage, or route. Administering the drug correctly and monitoring for reactions are important, but secondary to preventing initial errors. Question 3. A nurse notices that a patient is increasingly confused, has slurred speech, and exhibits signs of severe dehydration postoperatively. What is the nurse's most appropriate action? A. Administer an analgesic and encourage fluids. B. Monitor the patient for 30 minutes before notifying the physician. C. Check the patient's blood glucose levels and notify the physician immediately. D. Encourage the patient to ambulate to improve circulation. Answer. C. Check the patient's blood glucose levels and notify the physician immediately. Rationale. Severe dehydration and confusion can be indicative of electrolyte imbalances or hypoglycemia, particularly postoperatively. Checking blood glucose levels and notifying the physician immediately is crucial. Delaying or assuming it's due to pain can be dangerous. Question 4. Which strategy should a nurse implement when administering a high-risk medication, such as insulin, to a patient with a history of noncompliance? A. Monitor the patient's blood glucose levels frequently post-administration. B. Administer the medication quickly to avoid delays in treatment. C. Involve the patient's family members in monitoring the patient's response. D. Have a second nurse double-check the dosage and route of administration. Answer. D. Have a second nurse double-check the dosage and route of administration. Rationale. Double-checking high-risk medications, particularly insulin, with a second nurse is a critical safety step to prevent errors. Frequent monitoring and involving the family are important, but secondary actions. Question 5. A patient is being discharged after a recent stroke. Which of the following instructions should the nurse emphasize to reduce the risk of readmission? A. Continue taking prescribed medications and attend all follow-up appointments. B. Resume all daily activities once the patient feels better. C. Focus on physical therapy but disregard emotional support. D. Limit intake of fluids to avoid increased stroke risk. Answer. A. Continue taking prescribed medications and attend all follow-up appointments. Rationale. Ensuring the patient understands the importance of medications and follow-up appointments significantly reduces the risk of readmission. Resuming activities prematurely or neglecting emotional support can jeopardize recovery. Question 6. When prioritizing patient care in an emergency department, which patient should the nurse assess first? A. A patient with a laceration requiring stitches. B. A patient with a temperature of 101 degrees Fahrenheit and malaise. C. A patient with chest pain and shortness of breath. D. A patient with a headache and recent visual disturbances. Answer: C. A patient with chest pain and shortness of breath. Rationale: chest pain and shortness of breath are indicative of potential life-threatening conditions, such as a myocardial infarction or pulmonary embolism. This patient requires immediate attention over less critical issues. Question 7. A nurse is caring for a patient on contact isolation due to a multi-drug resistant organism. Which action ensures the highest level of patient safety? A. Only wear gloves when in the patient's room. B. Strictly adhere to isolation protocol, including hand hygiene before and after patient contact. C. Allow the patient's family members to visit without wearing protective equipment. D. Limit hand hygiene to after patient contact only. Answer: B. Strictly adhere to isolation protocol, including hand hygiene before and after patient contact. Rationale: adhering to isolation protocols, including proper hand hygiene, prevents the spread of multi-drug resistant organisms. Family members should follow the same protocol for infection control. Question 8. A nurse discovers that a medication was administered to the wrong patient. What is the most immediate action the nurse should take? A. Inform the physician and document the error. B. Reassess the patient for any adverse effects of the medication. C. Monitor the patient for 24 hours before taking further action. D. Administer the correct medication to the patient immediately. Answer: B. Reassess the patient for any adverse effects of the medication. Rationale: the nurse must immediately assess the patient for any adverse effects, as they may experience harm from receiving the wrong medication. Documenting the error and notifying the physician follow after patient safety is ensured. Question 9. In a patient with sepsis, what is the most critical action to ensure patient safety? A. Administer antibiotics as soon as possible after obtaining cultures. B. Restrict fluid intake to avoid fluid overload. C. Monitor vital signs every hour and limit communication with the patient. D. Administer vasopressors and assess urine output. Answer: A. Administer antibiotics as soon as possible after obtaining cultures. Rationale: timely antibiotic administration is crucial to managing sepsis. Administering antibiotics without delay helps to prevent the infection from worsening, while fluid management and vasopressors are part of supportive therapy. Question 10. A patient presents to the emergency room with altered mental status after a suspected overdose of a benzodiazepine. What is the nurse's first intervention? A. Administer activated charcoal. B. Administer flumazenol. C. Initiate an IV line and start fluids. D. Monitor vital signs and oxygen saturation. Answer: D. Monitor vital signs and oxygen saturation. Rationale: the first intervention for a suspected overdose is to monitor the patient's vital signs and oxygen saturation to ensure their stability. Flumazenol may be used after this to reverse the benzodiazepine effect, but the patient's airway and circulation must be prioritized. Question 11. During an emergency response, a nurse must assess multiple patients. Which patient should be prioritized for care? A. A patient with a sprained ankle and minimal pain. B. A patient with an open femur fracture and uncontrolled bleeding. C. A patient with a history of hypertension and mild dizziness. D. A patient with a small laceration and controlled bleeding. Answer: B. A patient with an open femur fracture and uncontrolled bleeding. Rationale: uncontrolled bleeding from a femur fracture is a life-threatening emergency and should be prioritized over less critical issues such as mild dizziness or minor injuries. Question 12. In a patient who has just received a blood transfusion, which of the following is the nurse's highest priority? A. Monitor the patient's vital signs for signs of a transfusion reaction. B. Prepare the patient for discharge. C. Administer fluids to dilute the transfused blood. D. Administer pain medication for discomfort. Answer. A. Monitor the patient's vital signs for signs of a transfusion reaction. Rationale. Transfusion reactions can occur shortly after administration, so monitoring vital signs is the most important action. Pain management and preparing for discharge are secondary to monitoring for adverse reactions. Question 13. A patient with a recent myocardial infarction is being discharged. What key instruction should the nurse provide to minimize the risk of another event? A. Limit physical activity for 2 weeks. B. Increase dietary fat intake to improve energy. C. Avoid using anticoagulant medications. D. Take prescribed medications as directed and follow up with the cardiologist. Answer. D. Take prescribed medications as directed and follow up with the cardiologist. Rationale. Adherence to medications and follow-up care with the cardiologist are critical for preventing recurrent myocardial infarction. Limiting physical activity or avoiding medications would increase the risk of complications. Question 14. In a patient who is on a ventilator, what is the nurse's priority action to prevent ventilator-associated pneumonia, VP? A. Provide sedation as needed to keep the patient comfortable. B. Perform daily oral care with chlorhexidine. C. Change ventilator tubing every 24 hours. D. Ensure the head of the bed is elevated at 30 to 45 degrees. Answer. D. Ensure the head of the bed is elevated at 30 to 45 degrees. Rationale. Elevating the head of the bed reduces the risk of aspiration, which is a primary cause of ventilator-associated pneumonia. Oral care and sedation are also important, but secondary to positioning. Question 15. A nurse is administering a blood transfusion and notices the patient is showing signs of a reaction. What is the nurse's first action? A. Stop the transfusion immediately. B. Administer epinephrine. C. Notify the physician and continue the transfusion. D. Increase the transfusion rate to flush the line. Answer. A. Stop the transfusion immediately. Rationale. Stopping the transfusion is the immediate action to prevent further exposure to the harmful blood product. Once the transfusion is stopped, the nurse can assess the reaction and follow other steps, such as notifying the physician. Question 16. A nurse is caring for a patient with a central line. Which action is most critical to prevent central line-associated bloodstream infections, CLABSI? A. Administer antibiotics prophylactically. B. Use a septic technique during line insertion and maintenance. C. Change the dressing every 72 hours. D. Limit the use of the central line to essential procedures only. Answer. B. Use a septic technique during line insertion and maintenance. Rationale. Proper aseptic technique is crucial in preventing infections related to central lines. Administering antibiotics and changing dressings are important, but aseptic technique is the most important preventive measure. Question 17. What is the nurse's primary responsibility when a patient exhibits signs of an adverse drug reaction ADR? A. Document the ADR and continue administering the drug. B. Report the ADR to the pharmacist and adjust the dosage. C. Discontinue the medication and notify the physician immediately. D. Increase the frequency of monitoring the patient's vital signs. Answer. C. discontinue the medication and notify the physician immediately. Rationale: discontinuing the medication and notifying the physician immediately ensures the patient is protected from further harm and allows for alternative treatments to be considered. Question 18. When caring for a patient who is at high risk for falls, which action should the nurse prioritize? A. Implement bed and chair alarms. B. Reassess fall risk every 48 hours. C. Limit the patient's mobility to reduce the chance of a fall. D. Place the patient in a room close to the nursing station. Answer: A. Implement bed and chair alarms. Rationale: bed and chair alarms are crucial in alerting staff to a patient's movements, significantly reducing the risk of falls. Reassessing fall risk and placing the patient close to the nursing station are additional precautions, but not as effective. Question 19. What is the most critical consideration when managing a patient who is receiving mechanical ventilation and is at risk for barotrauma? A. Ensuring that the ventilator pressure is set within safe limits. B. Administering sedatives to keep the patient comfortable. C. Frequent suctioning of the patient's airways. D. Elevating the head of the bed. Answer: A. Ensuring that the ventilator pressure is set within safe limits. Rationale: safe ventilator pressure settings are essential in preventing barotrauma, which occurs due to excessive pressure on the lungs. Sedation and suctioning are secondary measures to manage the patient's comfort and airway. Question 20. What is the nurse's first action when a patient is found to have signs of anaphylaxis following an intravenous drug administration? A. Administer epinephrine immediately. B. Discontinue the IV medication and notify the physician. C. Place the patient in a supine position with legs elevated. D. Administer corticosteroids as ordered. Answer: A. Administer epinephrine immediately. Rationale: epinephrine is the first-line treatment for anaphylaxis, as it can quickly reverse the symptoms of this severe allergic reaction. Discontinuing the medication and notifying the physician follow after administering epinephrine. Question 21. A nurse is caring for a patient in septic shock. The patient's blood pressure remains low despite fluid resuscitation. What is the most appropriate next step? A. Administer vasopressors as ordered. B. Administer additional fluids. C. Increase the rate of oxygen administration. D. Reassess the patient's vital signs in 1 hour. Answer: A. Administer vasopressors as ordered. Rationale: when septic shock results in persistent hypotension despite adequate fluid resuscitation, vasopressors are needed to maintain adequate perfusion. Additional fluids may be insufficient to raise blood pressure in this situation. Question 22. A nurse is administering a transfusion of fresh frozen plasma, FFP, to a patient with a known coagulation disorder. What is the nurse's priority action? A. Monitor for signs of an allergic reaction. B. Check the patient's vital signs every 15 minutes. C. Warm the FFP before administration. D. Verify the patient's blood type and cross-match results. Answer: D. Verify the patient's blood type and cross-match results. Rationale: verifying blood type and cross-match is essential to avoid a hemolytic transfusion reaction. While monitoring for reactions and warming the plasma are important, blood type verification is the priority step. Question 23. A patient with a new diagnosis of heart failure presents with severe dyspnea, crackles on lung auscultation, and a rapid heart rate. What should the nurse prioritize in care? A. Administer oxygen to relieve hypoxia. B. Increase the patient's fluid intake. C. Provide pain relief and reassurance. D. Prepare for possible intubation. Answer: A. Administer oxygen to relieve hypoxia. Rationale. The priority is to alleviate hypoxia by administering oxygen, which is critical to improving the patient's oxygenation status. Pain relief and intubation are secondary considerations. Question 24. A nurse is caring for a post-operative patient with an epidural catheter for pain management. The patient suddenly reports shortness of breath and chest pain. What should the nurse do first? A. Administer supplemental oxygen. B. Assess the patient for signs of a pneumothorax. C. Notify the physician immediately. D. Check the catheter insertion site for signs of infection. Answer. A. Administer supplemental oxygen. Rationale. The priority is to ensure oxygenation and address potential respiratory distress. The nurse should monitor for pneumothorax or other complications, but oxygen should be administered first. Question 25. A patient has just been diagnosed with a deep vein thrombosis, DVT, and is started on low molecular weight heparin. What is the nurse's most important intervention? A. Monitor the patient's platelet count for signs of thrombocytopenia. B. Instruct the patient to ambulate frequently to prevent clot extension. C. Perform a complete neurovascular assessment of the affected limb. D. Monitor the patient for signs of bleeding and administer vitamin K if necessary. Answer. A. Monitor the patient's platelet count for signs of thrombocytopenia. Rationale. Heparin therapy can cause heparin-induced thrombocytopenia, HIT, which requires immediate action. Monitoring platelet count is critical to preventing further complications. Question 26. A nurse is caring for a patient with a traumatic brain injury, TBI, who is showing signs of increased intracranial pressure, ICP. Which action should the nurse take first? A. Administer a diuretic to reduce cerebral edema. B. Elevate the head of the bed to 30 degrees. C. Hyperventilate the patient to lower CO2 levels. D. Initiate a cooling protocol to reduce brain temperature. Answer. B. Elevate the head of the bed to 30 degrees. Rationale. Elevating the head of the bed reduces ICP by promoting venous drainage from the brain. Hyperventilation and cooling protocols may be appropriate later, but positioning is the first intervention. Question 27. A nurse is caring for a patient who has just undergone a coronary artery bypass graft (CAB) surgery. The patient is hypotensive and tachycardic. What is the nurse's priority action? A. Administer a blood transfusion. B. Notify the surgeon immediately. C. Assess the surgical site for bleeding. D. Administer intravenous fluids to restore blood volume. Answer. C. Assess the surgical site for bleeding. Rationale. The first step in managing hypotension and tachycardia post-CAB surgery is to assess for bleeding, as this is the most common cause of these symptoms. Question 28. A nurse is preparing to administer a high-dose opioid to a postoperative patient. The patient has a history of sleep apnea. What should the nurse do first? A. Administer naloxone to prevent opioid toxicity. B. Ensure the patient's oxygen saturation is continuously monitored. C. Restrict the patient's fluid intake to prevent fluid overload. D. Increase the dosage of the opioid to achieve better pain relief. Answer. B. Ensure the patient's oxygen saturation is continuously monitored. Rationale. Given the patient's history of sleep apnea, the priority is to continuously monitor oxygen saturation to detect any signs of respiratory depression from the opioid. Question 29. A nurse is caring for a patient with a tracheostomy tube who has developed a mucus plug. What is the nurse's immediate response? A. Suction the patient's airway to remove the mucus plug. B. Administer a bronchodilator medication. C. Increase humidification of the patient's oxygen. D. Call for assistance from the respiratory therapist. Answer: A. Suction the patient's airway to remove the mucus plug. Rationale: suctioning is the immediate intervention to clear the airway and relieve obstruction. Increasing humidification and calling for assistance can be done afterward. Question 30. A nurse is caring for a patient who is 48 hours post-appendectomy. The patient suddenly develops severe abdominal pain, nausea, and vomiting. What should the nurse suspect? A. Wound infection. B. Acute gastrointestinal bleed. C. Peritonitis. D. Urinary retention. Answer: C. Peritonitis. Rationale: severe abdominal pain, nausea, and vomiting 48 hours after surgery can indicate peritonitis, a life-threatening condition requiring immediate medical attention. Question 31. A nurse is caring for a critically ill patient who is receiving total parenteral nutrition, TPN. The nurse notices the patient's blood glucose levels are rising. What is the nurse's first action? A. Administer an insulin dose as ordered. B. Hold the TPN infusion. C. Assess the patient for signs of infection. D. Notify the healthcare provider of the elevated glucose levels. Answer: A. Administer an insulin dose as ordered. Rationale: managing hyperglycemia by administering insulin is the immediate action to take. Holding TPN may be appropriate later, but controlling the blood glucose levels is the priority. Question 32. A nurse is caring for a patient who has been diagnosed with acute respiratory distress syndrome, ARDS. The patient is requiring high levels of positive end expiratory pressure, PEEP. What is the nurse's priority concern? A. Ensuring that the patient is adequately sedated. B. Monitoring for signs of barotrauma. C. Administering intravenous fluids to maintain perfusion. D. Performing frequent chest physiotherapy. Answer: B. Monitoring for signs of barotrauma. Rationale: high PEEP settings increase the risk of barotrauma, so monitoring for signs of lung injury is the priority to avoid further complications. Question 33. A patient in a psychiatric unit becomes agitated and threatens to harm others. What is the nurse's immediate response? A. Call for security to restrain the patient. B. Encourage the patient to express their feelings verbally. C. Administer a sedative as ordered by the physician. D. Maintain a calm and assertive demeanor to de-escalate the situation. Answer: D. Maintain a calm and assertive demeanor to de-escalate the situation. Rationale: the first intervention should be to de-escalate the situation verbally, maintaining a calm and assertive approach to prevent physical escalation. Question 34. A nurse is caring for a patient who is 72 hours post-cardiac surgery. The patient suddenly develops a fever, and their white blood cell count is elevated. What should the nurse suspect? A. A postoperative wound infection. B. Pulmonary embolism. C. Atelectasis. D. Cardiac arrhythmia. Answer: A. A postoperative wound infection. Rationale: post-surgical fever and elevated white blood cell count commonly indicate an infection, often at the surgical site. A prompt investigation of the wound is needed to prevent further complications. Question 35. A nurse is caring for a patient on high-dose corticosteroid therapy. The patient presents with signs of Cushing's syndrome. What should the nurse do first? A. Notify the physician immediately. B. Administer a potassium supplement. C. Stop the corticosteroid therapy abruptly. D. Perform a complete neurological assessment. Answer: A. Notify the physician immediately. Rationale: notifying the physician is the first step, as adjustments in the corticosteroid regimen may be needed to prevent further complications. Question 36. A nurse is caring for a patient in the intensive care unit who is being weaned off a ventilator. The patient suddenly becomes agitated and begins to desaturate. What is the most critical intervention? A. Increase the oxygen flow rate. B. Reintubate the patient immediately. C. Administer a sedative to calm the patient. D. Reassess the patient's respiratory status and call for assistance. Answer: D. Reassess the patient's respiratory status and call for assistance. Rationale: the patient's respiratory status must be reassessed quickly, and assistance should be called for possible reintubation or adjustment of the weaning process. Question 37. A nurse is caring for a patient with chronic kidney disease who has developed hyperkalemia. What is the priority action? A. Administer a potassium-binding resin. B. Increase the patient's fluid intake. C. Prepare the patient for dialysis. D. Administer sodium bicarbonate. Answer: A. Administer a potassium-binding resin. Rationale: potassium-binding resins are the first line of treatment for hyperkalemia. Dialysis may be required if the condition worsens, but managing potassium levels is the priority. Question 38. A nurse is caring for a patient with a suspected pulmonary embolism. What is the nurse's priority action? A. Administer oxygen therapy. B. Place the patient in a supine position. C. Prepare the patient for a chest X-ray. D. Administer anticoagulants as prescribed. Answer: A. Administer oxygen therapy. Rationale: administering oxygen therapy is the first priority to maintain oxygenation. Anticoagulants and diagnostic tests are important, but secondary to stabilizing the patient's breathing. Question 39. A patient who is receiving chemotherapy develops neutropenia. What should the nurse instruct the patient to do to minimize infection risk? A. Avoid crowded places and practice strict hand hygiene. B. Discontinue all medications immediately. C. Consume a high-protein, low-sodium diet. D. Increase physical activity to boost immunity. Answer: A. Avoid crowded places and practice strict hand hygiene. Rationale: neutropenic patients are at high risk for infections. Avoiding crowds and maintaining strict hand hygiene are critical to minimize exposure to pathogens. Question 40. A nurse is caring for a patient who is in severe pain after a motor vehicle accident. The patient begins to show signs of shock. What should the nurse do first? A. Administer pain medication to manage discomfort. B. Begin fluid resuscitation with normal saline. C. Call for emergency assistance to prepare for surgery. D. Position the patient with their legs elevated. Answer: B. Begin fluid resuscitation with normal saline. Rationale: the priority is to restore circulation and prevent further shock. Fluid resuscitation is the most immediate and critical intervention in shock. Pain management and positioning can follow once circulation is stabilized.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!